Our next speaker is Barb Spurrier. Barb is Administrative Director in Mayo Clinic's Center of Innovation since 2008. She has held professional appointments from 1990 to 1997 as Chief of Ambulatory Care at the Department of Veterans Affairs Medical Center in Minneapolis, as well as Senior Clinic Manager and then Senior Administrator at Health Partners in Bloomington. She joined Mayo Clinic in Rochester in 1997 and served as an Operations Administrator of Rheumatology, Hematology, and Cardiovascular Diseases and Hospital Operations in the Department of Medicine. She was named Vice Chair of the Department of Medicine in 2003 and served in this capacity until 2008. In 2008, Barb was named Administrative Director of Mayo Clinic's new Center for Innovation, also known as CFI. In partnership with a physician leader, Barb has been responsible to build the CFI with a mission to transform the delivery and experience of health and health care and advance a competency of innovation across Mayo Clinic. Barb has continued her involvement with the University of Minnesota School of Public Health MHA program since graduation, serving as a preceptor, member of the Alumni Board, and a guest lecturer. Barb is co-author of a new book, Think Big, Start Small, Move Fast, a blueprint for transformation from the Mayo Clinic Center for Innovation. Please join me in welcoming Barb Spurrier.
Thank you for the warm introduction. I am absolutely delighted to be here with you this morning, and there have been some great speakers, and I hope that I can build on the momentum going on here around this Ignite theme. And I think when we think about Ignite and love that as the theme for this networking opportunity and conference, you know, it's really, the world's operating in such fundamentally different ways. And igniting our teams and our companies and our industries and igniting ourselves, I don't think it's ever been more important. So really, really happy to be with you here today. So what I'd like to do is move into the talk, and you know, I don't have enough time to provide a history lesson of Mayo Clinic. I am so blessed to be part of such an amazing organization. I suppose there's familiarity with Mayo Clinic, and we are now in our sesquicentennial year. It's taken me a while to be able to say such a big word, sesquicentennial. I used to just say 150 a year, a sesquicentennial, so I get that out there now. And just amazing in terms of the journey of Mayo Clinic. And the only thing I'll say in terms of the history and the context to set with you is that the needs of the patient come first. And that is the primary value of Mayo Clinic. That's really all we really need to remember. But I think that as we heard from Dr. Laura, in fact, the timing of having Laura speak first could not have been better for me, as she really helped to articulate the importance of innovation. And I'll be referring to some of the things she described now in my talk. But the needs of the patient come first. And really, if I tell the long story short of how it is that the Center for Innovation was launched 6 years ago, this idea that we understand the needs of our patients, the way that we were understanding those needs was really through things like patient satisfaction surveys. And of course, that's a retrospective, review of things that doesn't tell us at all what people need. So the shift that's been going on is really one, not just about patients who are sick to understand needs, but a big shift going on with Mayo Clinic because we really are in the knowledge to delivery business. How do we take our specialty, subspecialty, incredible clinical knowledge and really connect that with people and patients wherever they are? In fact, our CEO, Dr. John Noseworthy, describes that as connecting to 200 million people around the world in a meaningful way. So a lot going on in this healthcare, health continuum, and Mayo is right in the midst of some very exciting change. But the Center for Innovation is fundamentally about understanding the needs of customers, consumers, patients, people, families, and trying to serve those needs. So the mission here has not changed in our 6 years. transforming the experience and delivery, not just of healthcare, but also of health. This is our definition of innovation, and I'm sure in your organizations, in your lives, there's so many definitions out there. It was important for us to try to center in on what we are doing and what we're not doing. And so our work is in discovery and implementation, execution of new models to deliver better health. There are a lot of innovation activities going on in academic medical centers and other healthcare organizations, very, very important. But they may approach it from a medical device, or here's the shiny technology, and now I'm going to figure out the problem it's trying to solve. Ours really starts from trying to understand needs of people in a human-centered design construct, and then building out those models. And our journey is really one around discovery, ideation to implementation. If we don't get those models, products, and services out to help people, patients, customers, consumers, then we have not succeeded. So we'll talk a little bit more about that as we move into our methodology. There are a couple of quotes in here that I just love and I think have been so important in what we've been building over the last 6 years. So this one here by Al really speaks to problems that exist in the world and the need for a thinking differently mindset. And again, a number of the speakers are picking up on this theme. This is the Center for Innovation today. So, you know, what you see is lots of different backgrounds, experiences, skill sets, training that are really coming together. And the sense is that there's no way, if we approach things the way we have in traditional healthcare and healthcare delivery, where we have really smart physicians and scientists and nurses, and we try to understand the world around us and then move things forward. We all know from our own experiences that the field of healthcare is so in need of transformative kind of innovation. So this is so exciting because we have, of course, physician scientists, members of our care teams. We also have technologists, we have engineers, and we have designers. And we've actually been called pioneers in bringing designers and design thinking, to Laura's point, into healthcare delivery. So one of the first recruits into the team, and also very fortunate that we've been guided by IDEO, a company that Laura referenced. In fact, the CEO of IDEO is Tim Brown, and he sits on our external advisory council of our Center for Innovation. And so that is really part of the journey we've been on too, is that we can't look, you know, within ourselves and in an insular way to understand things. It's been really important to open things up to the world around us and really learn about innovation and design and user needs from other industries. So that's all helped to inform where we are today. What I would also say when you see all of these backgrounds and kinds of people, it's the most multidisciplinary team I've ever had the privilege of working with. So just incredible passion. You can imagine anthropologists, designers coming into a place like the Center for Innovation. You know, they bring a lot of passion with what they've seen in their own lives, or some story of what they're trying to do to really make a difference. And it's really about innovation with impact. What we do in our structure is we're trying to build a distributed network of innovation. We are the Center for Innovation, not the Center of Innovation, and we're really trying to build this capability across Mayo Clinic and beyond. And so if we have skill sets that exist across Mayo, like in business development and technology, what we do then is people stay in their home departments and centers and areas, but we pay for all of their time, their FTE, so they're fully aligned with our work in transforming health and healthcare. And the model's working really, really well. If it's a skill set we think we need in innovation that we don't have, then we recruit those kinds of folks into our Center for Innovation, like our designers and our project managers. So that's just a little bit about the structure. And the thinking differently mindset is, you know, what I would put out there that is so important. This is another one from the very wise Mr. Jobs, that design is such a funny word. that we many times think of design as how things look, but it's really how things work, and everything around us is designed in some aspect. So that's what we've really been building out, is a whole capability around design. This is our methodology at a very high level. We get into all kinds of things like many of your companies and organizations where when we launch projects, we get into project charters and metrics and all of the detail and the stop gates and things along the way. But if we pull that methodology up to a higher level, you see that expressed here. It's really a scanning and framing in terms of what's going on in the world around us. Our designers are really good at looking at things that are happening and understanding patterns, and that really helps us in our work. Then we move into experimenting, and that's been really important. In fact, my physician partner for the first 5 years at the Center for Innovation is a physician scientist named Dr. Nick LaRusso. He and I partnered in the Department of Medicine for many years together too, and Nick is a physician scientist. And so we were able to bring some of the scientific method that we've been fusing together with design thinking together in what we've been creating. But this idea of experimentation, and people ask me all the time, well, what about failure? And sure, there are things that just don't work and they combine together in different ways. It's a lot about learning. And so that really occurs usually in the experimentation kind of phase. And then what we try to do is move into prototyping, to Laura's point, get to the low fidelity prototypes that you can start testing to see if they can be sustained in a real world, and then on to implementation. And we try to engage the implementation side of Mayo directly in the work. The idea of co-creation with patients and people, of course, and also with those that would take on the responsibility of the operations of some sort of new product or service. So I think we all know how it feels if somebody, develops something new, discovers something new, and then hands it to us to say, oh, don't you love this, now go implement it. It's much better to be involved in the process as much as we can try to anticipate the need. But some of the things we're building have never existed before, at least at Mayo. So sometimes that can be a significant challenge. I list the core metrics here. Everything's been about iteration in the Center for Innovation. This is what I would call out for you as our core metrics. So what we're really trying to do is evaluate the speed to the first completed prototype. Move through that experimentation to get to something that we can be testing. We're trying to look at, as part of the 200 million people around the world that we really believe we can help with our Mayo model and our Mayo expertise, being part of that in terms of how many lives we're touching in a meaningful way. And then the third metric really is about revenue growth, expense reduction, but it's really in this commitment to transformation that typically is a 3 to 5-fold reduction, increase. Directionally, it's pretty ambitious in terms of its scope. Another one I love, all life is an experiment. The more experiments you make, the better. And I think that's what we're really finding in terms of the phenotype for innovation, is people that can come into it when you see that team that really have that experimental kind of mindset and are really open to learning and the discovery that occurs along the way. And that would be the same for our physicians. So not everyone can come into this world of innovation. It can be a very, very messy process and thrive. And so it's been a lot of learning around how do you bring the team together and how do you try to build that across the organization. There are lots of companies that are listed here, and we don't have time to get into the stories. It doesn't list all of the organizations, in fact, that we're collaborating and partnering with now. But I'd go ahead and make just a couple of comments. When you look down in one quadrant, you see a number of universities, like the great University of Minnesota that we heard about this morning. And that's really a way that we access a lot of talent. So there's so much energy and creativity out there in the world, and how do we create opportunities to have really smart students and learners join us in our work? So we love to have, whether they're design students that need to do the applied kind of learning from classroom to an actual program or project, they join us at the Center for Innovation. Whether it's an engineering student from Purdue who needs to complete her PhD in systems engineering that works with us on a remote monitoring project and finishes her PhD with us, that's phenomenal. Whether it's business students from the University of Minnesota that are part of the Carlson Venture Enterprise activity, and these are not just MBA students that are just first out in their learning. They have startup experience, they're lawyers. They join us and help accelerate the pace of the work that we're doing. And then many other companies. I put the conference board up there, and I love the comments that were just made by the speaker before me around networking and how do you think about the 90%. And for me personally, because I'm new to the world of innovation 6 years ago, when our board asked me to play a role in helping to build this for Mayo Clinic, the conference board council on innovation includes directors of innovation from large corporations. I'm the only one who sits on that council that's from healthcare, a not-for-profit, they're all for-profit. It's directors of innovation from FedEx, from Procter & Gamble, from ExxonMobil, all different kinds of companies. But we have so much in common in thinking about building out innovation in our organizations, and we've become very, very good friends. So that is an organization I wanted to mention. These are the kinds of industries that we're looking at, incubators, government, health systems, academia, industry. Really, when we think about the commitment to transforming the experience and delivery of health and healthcare, there is no way Mayo Clinic can do that alone. And it really is about this whole idea of the ecosystem. So how we really ignite our players to come together and build an ecosystem that works for people and patients is the work that's happening. This is our framework in terms of how we approach our work, and you can see that we have platforms. We try to call out the smallest number of really big ideas, and in each platform we have a portfolio of projects. That's a lot of keywords, but that's how we're organized. And we describe it as always be there for me. So always be there for me when I need to come to you. And that's our innovation going on around the core of Mayo Clinic and the practice. Lots of opportunities to improve the experience for patients and family members in our clinics and our hospitals. And that's actually occurring across the Mayo enterprise. So you may be familiar that we have where Mayo Clinic started in Rochester, Minnesota. We also have Mayo Clinics in Arizona and in Florida, and then our Mayo Clinic Health System. Always be there for me when you can come to me and when I didn't even know you. And that's our work in health and well-being. This gives you an idea of some of the kinds of projects we're working on, from apps that connect for adolescents trying to manage their asthma that don't want to come in and see the physician in the office practice, but could use their smartphone to connect to the care team and be texting their provider, to things like video visits where we're connecting our doctors right to patients in their homes, to try to make care much more convenient and much more affordable. The other platform is always be there for me, and this is for our staff and employees. Help me understand innovation and apply it to my daily work. We have a number of offerings. 6 years ago we had none, and now we have things like this. I'd mentioned just two. The garage is a new activity that we're working on with our Mayo Clinic Ventures. What about ideas that could lead to commercialization, and how do we provide the incubation to get them out in the world? Code is Connect, Design, Enable, which is seed funding for really good ideas across Mayo. The ideation has to be implemented within 12 months, and we provide seed funding and a huge celebration, to the point about the importance of celebration. And what I'm going to do now is give you share a short video. If you'd like to come see us at the Center for Innovation, I welcome you. But for now, if we can do a virtual tour.
The Ganda Building at Mayo Clinic is a destination for people from around the world. Within these walls, teams of specialists seek answers and provide high-quality, compassionate care. In this same building, you'll find the Mayo Clinic Center for Innovation. It's been called a laboratory, a petri dish, an incubator. It's all of these things and more. And that's by design. Because innovation is a creative, fast-moving, unpredictable endeavor. In the Center for Innovation, teams of experts from Mayo Clinic and elsewhere come together, focus intensely, explore possibilities, transforming the delivery and experience of healthcare for the benefit of patients around the world. It's been said that you never step in the same river twice. The Center for Innovation is a river of ideas. Our space is designed to keep the ideas flowing. There's room to build prototypes and play with new technology. To drop by for a few minutes or settle in and work out a solution. But there are virtually no permanent walls. The space adapts to the ideas of the moment, encouraging people to jump in and contribute. The Center for Innovation is embedded within Mayo Clinic's medical practice. By design, we go into the provider's space to observe. They drop by our space to contribute their ideas. And patients can be consulted at the moment of healthcare delivery. We have the opportunity to create laboratories in the care environment, so ideas can be rapidly piloted and adapted for use anywhere in the world. Prototype exam rooms are created in a highly flexible space to try out new ideas for more efficient, patient-friendly environments. We collaborate with partners from a wide variety of industries to develop innovations that will bring high-quality healthcare to more people in more places around the world. Innovation involves both scientific method and improvisation. We believe the best space for innovation is one that doesn't get in the way, that encourages people to connect, that gives them room to design unique solutions, that promotes the sort of disruptive innovation that changes the world. The Mayo Clinic Center for Innovation, transforming the delivery and experience of healthcare by design.
Hopefully that helps you have an idea of the work that's going on in the Center for Innovation. And I'm just going to conclude quickly with this slide. These are the things that we've been learning, and again, it's a journey for so many of our organizations around the world. The importance of building a discipline of innovation, it's really emerging that way. The importance of having diversity in the team and bringing in new skill sets. Embracing creativity and design thinking, really building that creative confidence in individuals and organizations, very, very important. We really believe that environments matter. Having places like our labs and places to come into a safe harbor to do the prototyping. The co-creation with customers, patients, people, and stakeholders. The organization around big idea platforms, and the importance of collaboration across your organization and beyond across industry. So I conclude with that, and thanks again for the opportunity to be here.